Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I'll be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting the toe. Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe. Great! Now we'll wait a few minutes for the toe to get numb. Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, first, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail. Great! Take the forceps and carefully remove the ingrown nail. It's getting kind of messy in there. Let's clean up that blood. See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that infection. That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not. When you're done inserting the acid, I'll remove the tourniquet and we'll finish up. Finish by applying some antibiotic ointment on a. Place it against the toe and wrap it in a gauze bandage. Fantastic job! Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Hello, and welcome to Surgery Squad's virtual laparoscopic cholecystectomy. I'm Dr. Susie, and I'll be guiding you through this procedure today. Your gallbladder is basically a place that stores bile generated by your liver. As your body digests fats, your gallbladder pushes bile into the common bile duct, down to your small intestine, to help digest them. Gallstones form when the bile hardens into small pieces that block the common bile duct. These stones can consist of calcium, blood, and cholesterol, and they can cause moderate to severe pain, along with nausea and/or vomiting. When this happens, it is called a gallbladder attack. Gallbladder removal is the best treatment for gallstones. There are two types: open gallbladder surgery and laparoscopic cholecystectomy. Open gallbladder surgery involves one large incision and removal of the gallbladder. It is performed when the laparoscopic method is not possible, or when complications or too much scarring from previous surgeries are found, or when the patient's blood won't clot well. This type of surgery causes more pain and longer recuperation time. A laparoscopic cholecystectomy, however, is the most common and often the best method to remove a gallbladder. It is where the gallbladder is removed through several small cuts in your abdomen. The surgery is safe, and folks who have it normally recover within 1 week. There are a number of benefits to having laparoscopic cholecystectomy. Among them, you'll be able to eat food without pain in most cases. It eliminates any discomfort in the stomach lining, and in some cases, it relieves your upset stomach. However, if you have your gallbladder removed, you might experience chronic diarrhea, indigestion, trouble digesting, severe liver problems, fatigue, and rare but intense abdominal pain. The patient waiting for us has been suffering from pretty severe gallstone pain, so it is imperative we get his gallbladder out. Let's scrub up and get going. Our patient is already under general anesthesia, thanks to our nurses and anesthesiologist. We're going to make 4 small incisions, 1 right below the belly button and 3 others right over the abdomen. First, we'll disinfect the area where we're going to make our first incision. Good. Now take your scalpel and make a small incision right below his belly button. Nice and clean. We've got to see where we're going, so we'll first inflate his abdomen with a little carbon dioxide to have some room to work. Just right. Now we'll use this laparoscopic camera to help us see where we're going. We'll watch our monitor as we go. Slow and steady. You're doing a great job. And there it is. I'll take care of the other incisions for our laparoscopic tools. Now that all of the trocars are in place, can you move the liver out of the way? Excellent work. We should have plenty of room to work now. Before making any incisions into the gallbladder, we'll need to clamp off the bile duct in 3 locations.